We're taking a look at the Glasgow Coma Scale to you today, and we're looking at the Glasgow Coma Scale because we're talking about signs and symptoms for neurological diseases, and neurological diseases has to do with the level of consciousness of an individual too. Okay, so we'll be looking at the Glasgow Coma Scale, which is basically a scale that is used to actually assess how conscious a person is. All right, so on Glasgow Coma Scales, there are basically three things that you're actually looking out for. The eye opening level, you are looking at the verbal response of the individual, and you're looking at the motor response of the individual, right? So we'll be looking at each of this and we'll be adding notes on them. Okay, but let's define what the Glasgow Coma Scale is. The Glasgow Coma Scale is used to objectively describe the extent of impaired consciousness in all types of acute medical and trauma patients. Okay, so if you have a trauma patient, maybe anything happened to the brain, anything happened to their nerves, okay, and you want to test their level of consciousness, you use the Glasgow Coma Scale, trying to check out their eye opening, trying to check out their verbal response, and trying to check out their motor response. We'll talk about that. So the Glasgow Coma Scale assesses patients according to three aspects of responsiveness. That's the eye opening, the motor response, and the verbal response. Okay, so this is it, guys, and I think I think I'll prefer to use this image. So for the eye opening, you try to check out if the person opened the eye spontaneously. Maybe when you came to the side of the bed of the patient, they opened their eye because they noticed a human being was there. So if they open their eye spontaneously on feeling your presence, you score them 4. Okay. If they open their eye only when you spoke to them, you score them 3. If they open their eye to pain, maybe you tap them with a patella hammer, you score them 2. Then if you did all of this to the patient, but the patient could not open their eye, then you score them 1. Okay. Then moving on to the verbal response, you try to like ask the patient some questions. Maybe you bring like you bring like the family member that escorted them to the hospital, and you're asking them like, okay, who is this? Okay, you ask them precise questions, simple questions that you know that a normal human being should answer. Okay, and you can ask them like, okay, where do you feel you are? Okay, where do you feel you are? And well, basically you just ask them like, okay, what is the time? All right, all these simple questions. So if the way they are talking is oriented, you score them 5. If they are confused, you score them 4. If they are using inappropriate words, you score them 3. If they are using incomprehensible words, that's they're just talking about some different language that I can't really understand, is 2. If they can't talk at all, it is 1. How about motor response? Okay, you check out if the patient can actually obey commands. All right, maybe tell them to walk to the door. If they can obey you, you score them 6. If they can localize pain, okay, localize pain, like, okay, maybe tap them at a particular region and you know that you tap them at this region, you score them 5. If there's flexion to pain, all right, maybe like use a patella hammer on their knee and you see that they're actually flexing their leg due to pain, you score them 4. If there's abnormal flexion, that's like tremors or abnormal twitching of the muscles, you score them 3. If there's extension due to pain, instead of flexion, there's extension, you score them 2. And if there's no response to tapping using the patella hammer, you score them 1. Okay, so the total score for Glasgow's Coma Scale is 15. Mild head injuries is usually scored between 13 to 15. Moderate head injuries is usually between 9 to 12. That's after you actually check out all these things and you score the patient. If this patient is scoring 13 to 15 and you know that they have just a mild head injury, okay, and if they have a moderate head injury, if the score is between 9 to 12, that means the moderate the head injury is graded moderate, okay? And if their score is less than 8, maybe 3 to 8, that means they had a severe head injury and it affected so many regions of their brain, okay? So they can't really do the eye opening properly, the verbal response properly, and they can't obey motor response too. Okay, so guys, this is it. Basically, this is the same thing here. Okay, but I preferred actually using this one because it had some images. All right, so it will actually calm you guys now to know that I'm talking about the eye, to know that I'm talking about verbal, that's talking, to know that I'm talking about motor response, that's you moving your muscles. All right, so guys, that's it about Glasgow Coma Scale, using for examination of eye opening, motor response, and verbal response. So see you guys, and bye for now.